Well, as you have heard, the number of nurses graduating in Maryland is simply not keeping pace with the nurses we will need over the next 10 years. Ironically, in recent years, Maryland nursing schools have had to turn away significant numbers of qualified applicants because there are not enough faculty available to handle the additional numbers of students trying to get in the door. A broad-based coalition of healthcare professionals, educators, nurses, administrators, and others first came together in 2007 to solve Maryland's nurse shortage. What has evolved is the Who Will Care campaign, spearheaded by the Maryland Hospital Association. The goal of the plan is to raise $60 million from public and private sources to provide the wherewithal to graduate an additional 1,500 nurses per year. That will require $20 million in pledges from private sources by the end of this year. The Who Will Care Fund for Nurse Education, hosted by the Maryland Healthcare Education Institute, which is an affiliate of the Maryland Hospital Association, will award grants for increasing the number of graduates at eligible nursing schools. Now, these grants begin to increase the number of nurses so we won't face a huge chasm when almost half of the nursing workforce retires just as the baby boomers generation health needs reach their peak. Currently, and this is something that we really need to pay attention to, the poor economy is really masking the problem. But when the economic downturn ends, we will face an exodus of nurses who postponed retirement or who expanded their work hours recently. We cannot take our eye off of the long-term goal of meeting our future nursing demands. Now, today, it's my pleasure to announce that as of this date, we have received pledges of some $15.5 million, which will be paid down over the next 5 years.